You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, board-certified oral and maxillofacial surgeon, Dr. Scotty Boulding. Dr. Boulding, welcome to the program.
Randy, it's nice to be here.
Now, before we get into today's topic, for people that don't know your practice, your center, tell me a little bit about who the typical patient is that comes in for dental implants.
Randy, we have a variety of patients that come in to see us. They can range from ages from 16 all and up. So it can be patients that have congenitally missing teeth or missing teeth, like a central incisor or something they were born without. Or it can be patients that have had no teeth for a long time. They've been wearing dentures for a number of years and they think they have no options. But dental implants give them an option to get their teeth back so that they can smile again, eat again, and really function normally so that they can eat that steak, they can eat that apple, they can eat anything that they want with dental implants.
Now, we said at the top of the show, no more dentures. Is that possible? I mean, is that the future of dentistry?
Randy, I believe it is. And I've told you before on this show, my mother has worn dentures for a number of years, and she didn't think there was any other option. And as a matter of fact, her father, my grandfather, was told that she would never be able to keep her teeth, so she had her teeth removed at a very young age. So she lived most of her adult life with wearing dentures.
Like how many years?
Over 40 years. And so my father never saw her without teeth. I didn't know she had dentures until I went to dental school. But we were able to offer her dental implants, and today she can eat anything she wants. She can eat corn on the cob, she can eat apples, which she was never able to eat. So for her, we were able to give her 3 dental implants on her lower. She had a loose lower fitting denture and a lot of bone loss. So we're able to put those 3 dental implants in, and she can now snap her denture in. It's very stable. She can eat corn on the cob without any problem. She can eat apples. She can eat anything she wants. She told me at a Thanksgiving function, she said, "Scotty, look at me." And she put her apple in her mouth and she bit it. She said, "I haven't been able to do," with tears in her eyes, "I haven't been able to do that since I was a young girl." And so for me personally, dental implants, I've seen it transform my family's life. And we're seeing it transform lives all across the country. We're also seeing a significant change in patients' lives in our practice.
No more dentures. Many of Dr. Boulding's patients walk in without teeth and they walk out with a fixed set of teeth. A total transformation occurs in just one day. Traditional dentures should be a thing of the past. If you're wearing loose-fitting dentures that make it hard for you to eat and chew, well, there's good news. Fixed teeth, permanent teeth that don't come in and out. Make the call that's going to change your life.
It was a relatively painless, quick healing process. For that, I give Dr. Boulding the credit. I had 4 implants, upper, 1 lower. And basically I'd had a partial before that, but it was just night and day in terms of comfort. I can eat what I want to eat. And again, the process itself, it might have been a couple of days, but it was never more. The swelling was minimal. The pain in the procedure was minimal. It just, if I had known afterwards all of that, I would have done it sooner.
When I decided to do it, I was still frightened. I was still a little bit afraid. And afterwards, I was afraid. And actually, the recovery was very good. It was not too bad. And now that I've had them for I think it's about 4 or 5 months, I even forget they're there. And I did 2 cooking classes in the last month, and I was very confident, and I didn't have to cover my smile. I just go ahead and, I go to the tables a lot and talk to people, so it's really given me some confidence and some extra oomph with my personality. So I just love the whole thing.
Well, pain was minimal. I mean, I had a couple of days of discomfort after having that much work done, putting extractions, implants, and a temporary put in place. It was basically a mild discomfort for a couple of days.
had a choice between dentures or implants, and I chose implants to have done. And I love them. They're great. I can choose state. I can look up with confidence and talk to people now, and people tell me what a beautiful smile I have. And it's the greatest thing I could have had done.
So how old can you be?
Randy, the age really doesn't matter. You can be 90 I have patients in their 90s that are receiving dental implants, but you can also receive implants at a very young age. For example, if you're missing a central incisor, you're born without a tooth, we're putting them in as early as age 15, 16 in some individuals.
So if you're missing one tooth or a few teeth, dental implants.
Doesn't matter.
Could anybody argue with that this is the better approach?
Dental implants have become the standard of care in dentistry for the missing tooth. There is no reason today that anyone should go without their teeth in the United States of America.
So how soon can you eat after it's done?
Randy, you can eat immediately. I mean, you'll eat the day of the surgery. Now, it's a softer diet for a couple of weeks, but very soon you're eating full meals. It'll take about 2 to 3 months for the implants to completely integrate into your body. And once they've integrated into the body, then you're eating corn on the cob, apples, whatever you'd like.
Do you hear eating stories, by the way? They go, Dr. Boulding, I'm eating this, I'm eating that.
All the time. The patients will, usually I've gone out for my first steak dinner in a number of years, or I've been able to eat that apple, or bite into a corn on the cob. So there's it's story after story. As a matter of fact, one particular patient that we have was a professional chef, is a professional chef. And he had lived for a number of years with bad teeth. Of course, every day he's tasting foods, and this is what he does for a living. Well, he was missing a number of teeth, and we saw him and offered him a solution where he could have teeth in a day. So we were able to plan his case using some technology where we could actually plan everything that we wanted for his upper arch and his lower arch. We were able to take out and remove his teeth, place the dental implants, and give him a set of teeth that day that he could go and go back to work the next day, or he was off for a couple days. Now, the thing that he was concerned about is he didn't want dentures. And the reason he put off everything that he was doing is because he was afraid that if he put dentures in, he would lose the taste of his foods. And this is what he does for a profession. So we were able to give him these fixed implants, fixed teeth in a day. He had nothing in his palate. And he said it's just like his natural dentition. As a matter of fact, he says it's better. A true testimony to what dental implants can offer you today.
So you just brush them and go to see the dentist about every 6 months or so, and just like they're your own teeth?
In some respects, the implants are easier to keep clean than your natural teeth. Now, I'm not saying you should take out your natural teeth, because if you've got good teeth, we want to maintain those for life. But if you're unfortunate enough to have missing teeth, then the implants, the way they're designed, the technology today is truly amazing. All you have to do is brush them, keep them clean on a daily basis, morning and night, just like you would brush your teeth, just like your mother and your dad taught you, your hygienist has taught you, and professionally probably have them cleaned about twice a year. We recommend seeing the hygienist just like you do with your natural teeth. Every 6 months you should go in for a cleaning.
You don't have to wear a loose-fitting denture. Every patient says the same thing after they receive their fixed set of teeth. They say, "Doctor, I wish I would have done this years ago." With your new permanent set of teeth, you no longer have to think about what you can eat when you're at a restaurant, and you could say goodbye to sticky adhesive. Most people that come in for their new teeth just want to be able to eat, chew, and laugh out loud without worrying about their dentures. What they don't expect after the procedure is completed is the reaction they get from their friends and family about their new smile. They say that people react to them differently. Well, we did our research, and in just about every survey ever published on what people find attractive in another person, it's their smile. It's always in the top 3, if not number 1. So call now and schedule your complimentary consultation.
I chose the implants versus dentures. I didn't want to be the old guy popping his teeth out, throwing the jar at night. I wanted a permanent, fixed solution. I'm through. The pain is gone. I don't have to worry about it ever again. I'm set to go.
If I'd known beforehand, I would have done it much sooner. It was just an excellent experience.
He told me about 2 ways I could go, and I did not want the double plate where he would put my teeth in there, or they would come out, and I did not want to have to do that all the time. Take them out, slip them back in. I didn't want that. And so he fixed me up. He put my plate in, and it will stay in, and I don't have to take it out.
Now, what about pain?
Randy, surprisingly, it's not a very painful procedure. Most people think that it is. It actually is more painful to have the tooth removed than it is to put the implant in. Patients that have implants typically will have a little soreness after the surgery, but by the next day they're back functioning normal. Many of our patients, they come in and just get them over their lunch hour and go back to work.
Is that right?
So it's not something that you have to expect a long, painful process after you've had it done.
Now, when I hear statements like you walk in without teeth and you can walk out with a full arch, a full set of teeth,
That's true.
fixed in your mouth.
That's true.
Is that right?
Today we have the technology that we have today with CAD/CAM designs, digital planning. We can actually take someone's face and their mouth and gather the records ahead of time and plan the entire case so that you can walk in without teeth or poor teeth that need to be removed. We'll take those teeth out, remove them, and place your new set of teeth so you leave with a new set of teeth the day of the surgery. With dental implants, you can bite into a juicy apple. You can eat corn on the cob. You can eat it right off the grill. You can chew that steak that you've been trying to chew for years. You know, patients that wear dentures, when they go to the restaurant and they look at the menu, many of them are just looking at the menu to see what they can eat. What we see with our patients with dental implants is they can choose anything on the menu now because they can eat anything on the menu with their naturally filling teeth.
Yeah, but what about those people that just have bad gums? Their mouths are a mess. Can they get dental implants?
Randy, I am so surprised at the number of patients that are out there today that do not think they have an option. They either have bad cavities, bleeding gums, bad gums, loose teeth, and they think, you know, it's either way too expensive, or it's something I can't afford, or I'm not a candidate for this procedure. But they are, and we see patients all the time that come in and say, I wish I'd have known about this years ago. And so they come in, and we show them how simple it really is. We find a way for them to make it affordable, and we provide them a mechanism where they can come in, leave with nice, healthy teeth.
I would say it met or exceeded all my expectations for ease of use and not having to glue them in every day and them working loose later on in the day and this type thing. That was always pretty frustrating to me. And so I've always been very happy with them.
Just from my heart, I'd just like to tell you, if you're leery of having your teeth pulled and putting implants in, I give you my phone number and recommend him and not even worry about you calling me, because I'd have no problem, and I know I'm sure you'd have no problem if you just give it a chance there. If you want a big smile and not worry about getting right up in somebody's face and talking to them.
Dr. Boulding says no more dentures, and I agree.
Hi, I'm Debbie Siebers. Another great thing about replacing your loose-fitting denture with a fixed set of teeth is that you can eat healthy foods again. Foods that are filled with fiber. You can eat salads, carrots, apples, broccoli, or whatever your heart desires. Take charge of your health and start eating healthy food again. It's important to get fiber in your diet, and with a fixed set of teeth, you can start to eat nutritious foods again. Call the number at the bottom of the screen and find out more about your doctor and if you're a candidate for dental implants. Don't put it off. Start living a better life. And the best part, you can have it done in one day.
With dental implants, you can bite into a juicy apple. You can eat corn on the cob. You can eat it right off the grill. You can chew that steak that you've been trying to chew for years. You know, patients that wear dentures, when they go to the restaurant and they look at the menu, many of them are just looking at the menu to see what they can eat. What we see with our patients with dental implants is they can choose anything on the menu now because they can eat anything on the menu with their naturally filling teeth.
So you say that it's more affordable than ever to get dental implants. That just regular folks can afford this.
So Randy, we
Elaborate.
figured it out. Patients don't go to the dentist because they perceive they can't afford it. It's just like if they go and buy a car. If they go buy a car, they need a payment option. So in our centers, what we've done is we've created a way for patients to afford dental implants, afford that healthy smile, afford a full set of teeth.
So, for example, like a lower denture, somebody watching this.
Someone that has a lower denture could literally have a set of implants with lower denture for less than $200 a month.
So your center is carrying the financing, or it's outsourced?
Randy, I had a goal, and my goal was to make sure that we had every American that could receive a healthy smile.
Okay.
Dental implants, removable or fixed, whatever they want. They could have their own set of teeth. And my goal was to be able to make it affordable for patients. So it's hard to get credit today. It's hard for your consumers to get credit. It's hard for them to make ends meet. So if they're not going to, if they're trying to get if they're trying to get a job, or they're trying to get a new self-esteem, if they don't have a healthy smile or they don't feel good about themselves, it is very difficult for them to go in that direction. So regardless of their credit score, if they have the ability to pay, we offer a financing for those patients that want and need dental implants.
So your company, I mean, you're offering in-house financing, and it's not based on just credit score. Elaborate.
Randy, it's based on their ability to pay. I mean, we want to help these patients. You know, we have an opportunity now to offer patients in-house financing. So for as little as $200 a month, they can receive a full arch of teeth, either on the upper or the lower, and walk out with a healthy smile.
So tell me about the application process.
Randy, it's very simple. It's online, so they can either do it in the office or they can do it at home. And it takes about a 10-second check to determine whether or not you qualify. And here's the kicker. Once you're qualified, then you get to choose what your terms are. In other words, how much do you want to come out of your checking account each month, each week? So you can base the procedure, depending on how much you're qualified for, how much you want to pay each month, to make it easy for you to afford dental care. Our goal was to make sure that dentistry was affordable for everyone. And so if we could eliminate the barrier of cost and make it more affordable, then we could see more access to dental care across America.
After I had my implants, people did not even recognize me. They would come and talk to my daughter and ask how I was doing. And I'd be standing right there beside of her. And my daughter would say, well, ask her, she's right there. And they could not believe the difference that it lifted me up, and in my mouth, how much younger that it made me look, and how much it gave me more confidence to go on with my life. I was working in the public, and people, you know, I was forever thinking they were looking at my teeth, and they probably were, because they were sunk so far down in my mouth. After the dentures, implants, they pulled my upper lip out, made me smile more, and I didn't have to cover my mouth.
I can eat anything I want. Apples. The beauty of it, the whole thing is, now that it's all in there and everything, is that I can just go ahead and I forget. So I'll bite in an apple, or eat a steak, and you say, oh, what, you know, and then you know you got your implants in there, and I don't even think they're up there. So it's a great way to go through life without, thinking, I'm going to break a tooth, or I'm going to do that. You don't have to worry about nothing.
In our centers, you can walk in without teeth, missing teeth, or bad teeth, and walk out with a new set of teeth with dental implants. Patients are in our office, and when it's all said and done, they take the mirror and look in the mirror, and they see the smile. And many times when we see the patients look in the mirror, we see tears come down, or we see a smile that is coming from within. So the emotional aspect of this changes the patients so that as they're seeing a smile, it becomes more of an inner smile. Their true expressions of who they are about to be revealed.
I mean, you really believe you're changing people's lives with just teeth?
Randy, there's no doubt we are. I mean, for example, there's this young girl or young woman in our practice. Her husband's an executive for a major company in our area. She had significant cavities from a medical condition that she had as a young girl. As a result of those cavities, she could not smile. She was very meek in her presentation, and she came to see me pretty much hopeless, that she did not have any options. So once we saw her, told her what we could do, that truly none of her teeth were savable, they were all hopeless, and she had spent thousands and thousands of dollars, which I see all the time. Patients are spending so much money trying to save their teeth, and it's not that the dentistry is not good. It's not that the dentistry is not good. It's just that they're trying to save teeth that ultimately were hopeless anyway.
Okay.
And it's very frustrating to patients when they've spent thousands and thousands of dollars on their teeth and then they end up having them removed. Today, we're more aggressive with the dental implants. We're going to dental implants a lot quicker and a lot sooner just because we know the predictability of the dental implants is much greater than trying to save a hopeless tooth. So this young lady that had spent thousands trying to protect her smile or save her smile felt like she was in an endless situation. We were able to remove her teeth, plan her case to where she left with natural teeth that day or fixed teeth that day, natural appearing teeth that day.
Mm-hmm.
And today she is one of my best advocates. And it's very emotional every time you see her and talk to her because her story, she cannot tell us her story without crying, explaining to us how she is a different person today, how she can talk to her friends, smile at her children's sporting events. And more importantly, she said, my husband was an executive for this major company. Prior to this procedure, I never went to any of the events that he wanted me to go to because I didn't feel comfortable with my smile. Today, she's going to all the events with him. And it's rejuvenated their relationship, not only personally, but also professionally.
No more dentures. You can get permanent teeth that don't come in and out of your mouth. It's like having your natural teeth back. You can bite into a red delicious apple or corn on the cob, hot off the grill. You can even eat popcorn, carrots, or a juicy steak at your favorite restaurant. And the best part of getting your fixed set of teeth with dental implants, you end up with a beautiful smile, natural looking teeth. Patients tell us it's a huge boost to their self-esteem. When you look in the mirror and you like what you see, that's when your inner smile comes out. A new smile, it can spark romance. It can open doors to a new job and add to your overall charisma. Let's face it, a smile is how you communicate to the world. So don't put it off any longer. Make the call that's going to change your life.
So patient financing you're offered now with Patient Preferred. You say it's not a traditional lender. Elaborate on that.
Randy, we were able to work with some individuals that help us create a product called Patient Preferred. And Patient Preferred is your non-traditional payment option for patients. So if you have a low credit score or you feel like you're not going to qualify for credit, doesn't mean that you can't receive dental care today. Patient Preferred doesn't look at your credit score. It looks at your ability to pay.
Okay.
And it'll offer you easy, weekly, monthly financing for your dental procedures. The options for dentures wearers are very simple. They can either have a removable option with dental implants or a fixed option. With the fixed option, they can have 4 to 6 implants that give them a set of teeth that they don't have to remove. As a matter of fact, the roof of their mouth is completely exposed. On the removable option, we can do it with as little as 2 implants. Snap in, snap out, 2 or 3 or 4. 4 gives you the most retention. Or we can do 4 implants and give you a removable denture that doesn't have a palate so that you don't have that plastic in the roof of your mouth.
I have a full set of teeth and they're anchored in with the post and they'll snap in and out, but they will certainly stay in until I use both fingers to snap them out. And it's been for several years and I just love it like that. I have no problems with it.
I chose the implants versus dentures. I didn't want to be the old guy popping his teeth out, throwing the jar at night. I wanted a permanent, fixed solution. I'm through. Pain is gone. I don't have to worry about it ever again. I'm set to go.
I can choose stay. I can look up with confidence and talk to people now, and people tell me what a beautiful smile I have, and it's the greatest thing I could have had done.
If you have dentures and the bottom dentures are flopping around and you can't hold them in and you're very uncomfortable, then with dental implants, they're there and you don't have to worry about that. And so you can just live your life like you should be living it with dental implants.
No, I could not go. I would not go back to the denture stuff. It was just remarkable, the difference. It's just like night and day.
Can you be too far gone?
Randy, not at
to
all.
do this?
Not at all. For example, there is a young lady in our hometown, our community, who is married to an executive of one of the major corporations in our community. She was born with a condition where her teeth were very poor, the enamel was very soft, and she spent thousands in dental care trying to make her smile look good without success. She was very sad. She would not go to the functions that her husband would have at his company.
Because she was ashamed of her smile?
She was ashamed of her smile. She was embarrassed.
Is that common, by the way?
Very common. I mean, she didn't even want to go to the sporting events with her children, and if she did, she would not smile. And she said it made her look like she was either angry or sad or a very recluse individual.
Interesting.
And so when she came to our office and we showed her what the options were, and we ultimately removed her teeth and placed them with a fixed upper and lower so she could actually feel like she had her natural teeth, she is transformed into a new woman. And I wish you had her on the show because she would be worthwhile to show everyone the transformation that this can have in your life. She has become the soccer mom. She is able now to go to her husband's corporate events. And this is something she shared with me. She said, I go and smile and I feel so confident. And she says this with tears in her eyes.
So they look real.
They
it's
look
like
very
a cosmetic
natural. Very natural.
makeover,
very natural.
in a way.
Very natural.
Wow, it is amazing. I continue to be blown away by how easy it is to have dental implants. The results speak for themselves. It's like you're actually replacing your missing tooth or teeth with something almost as natural as your real teeth. Can you imagine a day where there are no more dentures or missing teeth? I know Dr. Boulding can. This truly amazing technology can help you get the smile that you've always wanted. Having a healthy smile can help you with that job you've wanted or keep you from being embarrassed in front of your friends. No more loose dentures or missing teeth. You can have a white, shiny, healthy smile. So why don't you do something about it today? Call the number on the screen and receive your free consultation. No more dentures, no more missing teeth, just a white, healthy smile. Call today. You're going to be really glad you did.
At our centers, we have a goal, and that is for every American to have a healthy smile. There are no more excuses. Minimal discomfort, age is not a barrier, and we can make it affordable by offering payment options.
I want to thank you for tuning in. I'm Randy Alvarez. As a recap, if you are missing one tooth or a few teeth, and especially if you have a loose fitting dentures, or if the teeth that you have now, it hurts to eat and chew, you really do have to make the call that can change your life. That's it for now. I wish you good health.